This is Chapter 12, Psychological Disorders, Section 1, Defining Psychological Disorders. And we will start off with some truth or fiction. In the Middle Ages, innocent people were drowned as a way of proving that they were not possessed by the devil. People with schizophrenia may see and hear things that are not really there. Feeling elated might not be a good thing. Some people have more than one personality dwelling within them, and each one may have different allergies and eyeglass prescriptions. Some people can kill or maim others without feelings of guilt. So all of these statements are true, and that will lead us into our discussion on what is abnormal. People are fascinated by the exceptional, the unusual, and the abnormal. During various moments, we feel, think, and act like an abnormal individual. Psychological disorders may bring unexplained physical symptoms, irrational fears, and suicidal thoughts. There are 450 million people suffering from psychological disorders, according to the World Health Organization, with these numbers coming from 2004. And depression and schizophrenia exist in all cultures of the world. Psychopathology, also called mental disorder or psychological disorder, involves patterns of thought, emotion, and behavior that are maladaptive, disruptive, or uncomfortable, either for the person affected or others. In the United States, about half of adults have a psychological disorder at some point in their lives. How do psychologists define abnormal behavior? When behavior is deviant, distressful, and dysfunctional, psychiatrists and psychologists label it as abnormal. Deviance. One approach is to define abnormal behavior as statistically infrequent, deviating from what most people do or from what the average person does. According to a norm violation approach, abnormal behavior is that which breaks current social rules or cultural norms, sociocultural standards of how we should or should not behave. So the deviant behavior of going naked in one culture may be considered normal, while in others it may lead to arrest. The second aspect of abnormality is distress. Another approach is to use personal suffering as a criterion for abnormality. By this view, experiencing distress is abnormal. Deviant behavior must accompany distress. And our third factor is dysfunction. A final criterion for abnormality is impaired functioning, which means having difficulty in fulfilling appropriate and expected roles in family, social, and work-related situations. If a behavior is dysfunctional, it is clearly a disorder. A practical approach to the behavior in context. The practical approach includes aspects of all of the above approaches, and it's defined based on its content, or what a person does, its sociocultural context, and the consequences of the behavior for the person and for others. What is considered abnormal also depends on age, gender, culture, the situation, and the historical era. In short, the practical approach sees abnormality as including those patterns of thought, behavior, and emotion that lead to suffering and significantly impair people's ability to function as expected within their culture. So what causes abnormality? Ancient treatments of psychological disorders include trepanation, exorcism, being caged like animals, being beaten, burned, castrated, mutilated, or transfused with animal blood. The supernatural model attributes deviant behavior to supernatural powers, like from demons or gods. This model was the main approach centuries ago, all the way through the late Middle Ages. However, it is still being used in many cultures around the world. Today, most researchers follow the biopsychosocial approach, which attributes psychological disorders to the combination and interaction of biological factors, psychological processes, and sociocultural context. The biological factors. The medical model explains behavior disorders as physical diseases or imbalances of bodily processes. This model gave rise to the concept of abnormality as mental illness to be diagnosed, treated, and cured by medical doctors. The medical model today is called neurobiological model because it focuses on genetic influences and biological disturbances, especially in the brain. The second part of it is the psychological process. Psychological models see mental disorders as due to the psychological processes, such as wants, needs, emotions, learning experiences, and outlook on the world that are disrupted by problems people experience as they try to resolve their inner conflicts, hello Freud, or overcome the effects of stressful events. And that goes right into the first one, the psychodynamic approach. And that was coined by Sigmund Freud. And it viewed abnormal behavior as due to unresolved, mostly unconscious clashes between instinctual desires and the demands of the environment and society. Such conflicts were presumed to have begun in childhood. If you remember the wolf man, the problem with his dreams was because of something he had seen as a child. The modern psychodynamic model focuses more on early interpersonal relationships, so it has evolved since Sigmund Freud came up with it. Second part is the social cognitive approach, and this is social learning. Here, theorists see disorders as learned behaviors, thoughts, and expectations. The third is the humanistic approach, or the phenomenological approach, and this views abnormal behaviors as blocks in one's growth towards self-actualization, usually by a failure to be aware of and to express true feelings. The third part of the biopsychosocial approach is the sociocultural context. The sociocultural model suggests that to fully explain psychopathology, we need to pay attention to the social and cultural factors that form the context or background of abnormal behavior. Sociocultural factors such as gender, age, marital status, physical, social, and economic situations, and the cultural values, traditions, and expectations of people all can influence the labeling and experience of disorders. For example, women in many cultures are freer to express emotional distress, which may contribute to the higher rates of depression seen in women. The acceptance of excessive alcohol use for men, but not for women, may explain the higher rates of alcohol abuse in men. Some psychological disorders are cultural general, and they're found in most cultures, and some are culture specific, and they are seen in only certain cultures. The diathesis stress model. This integrates the biological, sociocultural, and psychological factors to describe abnormality. According to this model, inherited biological characteristics and early experiences can create a predisposition or diathesis for developing a disorder, but it takes a certain amount of stress to actually trigger it. How many psychological disorders have been identified? The purpose of diagnosis is to determine the nature of people's problems so proper treatment can be administered. Having a set of categories of symptoms can help diagnose, as well as research on and understanding of psychopathology. The American Psychiatric Association's Diagnostic and Statistical Manual of Mental Disorders, or the DSM, and the most recent one is the DSM-5, is the classification system used in North America. For the most part, it is compatible with the World Health Organization's International Classification of Diseases, the ICD, and the International Classification of Impairments, Disabilities, and Handicaps, the ICIDH, which are used outside of North America. When we do our activity, our group project on learning about psychological diseases, we are actually going to use the ICD because it's more readily available. The DSM-5, the 5th edition, provides specific criteria outlining the conditions that must be present for diagnosis of a particular disorder. It says nothing about what causes disorders. The DSM-5 is consistent with the established WHO and ICD guidance to consider the individual's functional status separately from his or her diagnosis or symptom status. So instead of saying you have an autistic boy, you would say you have a boy who also has autism. And finally, the term mental retardation is no longer used. Instead, it's replaced with the words intellectual disability. And that does it for section 1 of our psychological disorders.